In this video, we'll talk about depression screening, cognitive impairment screening, and also assessment of mental state. Depression screening, you can use the questions derived from the PHQ-9 questionnaire during your interview. So, over the last 2 weeks, have you been feeling down, depressed, or hopeless? Have you been feeling a lack of energy? Have you been feeling like you're a failure or you've let people down? Have you been getting any thoughts of harming yourself? Are you finding that you find it more difficult to seek pleasure in things? Are you finding it more difficult to concentrate, for example, on the TV or when reading a newspaper? Have you had a loss of appetite, or are you eating excessively? Are you finding it difficult to sleep, or that you are sleeping excessively? Are you finding that you are more fidgety and restless, or more slow? And if you've said yes to any of those previous questions, what impact is this having on your day-to-day life? How is it affecting you functionally? Screening for cognitive impairment next. My favorite is the 6-item cognitive impairment test. The first question is, what year is it? What month is it? I'll now tell you a name and an address which I'd like you to remember, because I will be asking you the same name and address again at the very end. Mr. John Smith, number 10, Main Street, London, Ontario. Now say it back to me and remember it. Moving on. Roughly what time is it to the nearest hour? Can you count backwards from 20? Can you say the months of the year backwards from December? Now tell me that name and address again. Moving on, assessing for mental function, the quickest is ABPU, alert, responsive to voice, responsive to pain, unresponsive. You may be asked to do a GCS, where you assess eyes, verbal and motor. Maximum score is 15 out of 15. Maximum score for eyes is 4, which is eyes open. Moving down the score then to open to verbal command, open to pain, do not open. Maximum score for verbal is 5, which is orientated. Moving down the score to confused, words, sounds, no sounds. Maximum score for motor is 6, which is obeys commands. Moving down the score to localizing, withdrawing or normal flexion, abnormal flexion, extension, no motor response. Of course, some patients will have these parameters not testable. For instance, if a patient is intubated.